everybody, thank you so much for joining this webinar that's addressing the urban designers and other professionals on the importance of early and sustained and genuine engagement with local communities. So talking about residents, business owners, neighborhood organizations, and leaders, really to understand their history, the dynamics, and the unique needs, challenges, and opportunities that they have. Health Equity Initiative will share its expertise on effective strategies to engage and empower communities to meaningfully participate in planning their community and shaping a vision for their future. Additionally, a successful urban design project will be explored to understand barriers to productive participation and ways to overcome them. So what we hope to impart and what we hope to share with you is that you'll be able to discuss the importance and benefits of an authentic community engagement in urban design. Be able to list strategies for community engagement, as well as identify barriers and roadblocks to community engagement. And then we'll discuss strategies to overcome those obstacles to community participation. So we'd like to thank the Robert Wood Johnson Foundation for its enduring support of this three-part webinar series and our upcoming 2018 conference. We also owe the Gehl Institute gratitude for partnering with the Health Equity Initiative in this series as a subject matter expert in urban planning and design. So together, Robert Wood Johnson Foundation, Gehl, and Health Equity Initiative developed this thought-provoking recorded series for a multi-stakeholder audience to collaborate on engaging new allies in planning healthier cities. In essence, that's our mission at Health Equity Initiative. It's to build and sustain a global community that engages across sectors to advance health equity and to reduce health disparities. We're a nonprofit, we're volunteering our time, and we promote membership with privileges such as attending webinars, conferences, networking events, and access to publications for less than $10 a month as an individual and $250 per year as an organization. Please save the date of February 22nd and 23rd for Health Equity Initiative's second partnership summit, expanding on the webinar series, forming and engaging new allies in health equity movement. We appreciate Robert Wood Johnson Foundation support again with this interactive event with audience participation and a notable key speaker, Tanya Lewis-Lee, lawyer, producer, women's and health advocate, as well as wife to Spike Lee. So it's helpful to share one definition of health equity that we use, which is providing every individual the same opportunity to stay healthy and cope with a condition, regardless of socioeconomic conditions, race, gender, age, social status, living and working environments, and other socially determined factors. So now I'd like to introduce our esteemed moderator and subject matter expert in urban design, Shin-Pei Tsai. So Shin-Pei's experience in practice and policy converges on transforming the built environment so that it's more accessible, equitable, and sustainable. As the full-time executive director for Gehl Institute, she's shaping an agenda for a public life movement. Most recently, she served as the deputy executive director of Transit Center, a foundation that improves urban transportation, and created the Cities and Transportation Program within the Energy and Climate Change Program at Carnegie Endowment for International Peace, the foreign policy think tank. She's a commissioner for the New York City Public Design Commission and serves on the board of Transit Alternatives and In Our Backyards. Shin-Pei received a Bachelor of Arts with distinction from Cornell University College of Arts and Sciences and a Master of Science in Cities, Space, and Society from the London School of Economics and Political Science. We're very, very honored to have you, Shin-Pei.
Just kicking this off by thanking the Health Equity Initiative and Renata specifically for inviting Gehl Institute to partner with them on this very important topic. Renata had invited a colleague from the Gehl practice to speak at their summit last year on urban design, and I think we both saw a opportunity to combine our work and in pursuit of looking at the built environment for health equity. And so it's really great to be a part of this and to have partnered with you on the entire webinar series, and thank you for having us. So I thought I would just quickly give people a little background on Gehl Institute because it is a new organization, and it frames the conversation of why it's important to even think about community engagement and planning and built environment when we're trying to achieve health equity. So I just wanted to reiterate that Gehl Institute is a nonprofit. We're independent from the Gehl practice, founded by the Gehl practice. And our work really focuses on creating knowledge that advances systemic change. Our mission is to make public life an intentional driver for design, policy, and governance. And public life to us is the social interactions in public space and an everyday high quality public realm and civic life. That's very important. And the reason we believe in this, why do we think that people should, try to spend time together, is because being apart has actually become a health epidemic. And in fact, when we think about who can actually participate in public space, there are people who are systemically marginalized and are unable to participate fully in public spaces, which is another health negative impact. And this is a very unscientific chart. But just generally over the last 20 years, what we have found as we look over the trends is that as public space awareness has gone up, and you can see that public space is now on many cities' agendas, the equity and trust in public institutions has actually decreased. And so we felt that there was an opportunity to work on this. And just briefly, this is where the interdisciplinary work comes together, that design influences behavior just as much as policy influences design. And this is something where, we're trying to make connections between all these different areas. And in fact, the regular street is surrounded by policy decisions in order to inform its design. So that's something that we really look at, is how human behavior, all these different levels of space work together. And we're particularly focused at the block level. So we study public life in a myriad different ways and try to feed that information to decision makers so that they can create better policies that would influence design that then influences healthier behavior. We share the tools, and actually our tools are being published this week, so check our website. We're also creating a common language to read the tools and organize the data. And we want to show people how it's done. So we really want to have a democratizing effect on how to do all of this, how to look at public life and see that it's impactful and present everywhere. So I just want to land on this idea that we can do it. It takes a village to make this happen. That's where our work is focused. The first speaker, Glenn Ellis Sr.
Pay for and Friso and Naomi and certainly Renata for the leadership on this whole initiative. So I'm going to just take a couple minutes. I just wanted to share some thoughts and experiences, ideas about community engagement as it relates to urban designers. So I guess one of my things I would like to make sure we all can really kind of pay some attention to is the concept of community engagement. And I found a working definition that I just wanted to share, that it's a planned process. And I think often that's a very overlooked aspect of it, that it's seen more as a component and not actually a planned process. And the other aspect I wanted to highlight in that context is that it involves both stakeholders and communities. And I'll get to why that's an important distinction that we have to keep in mind. And how, back in 2001, Dr. Wilder did a study, a paper rather, and talked about just how that it's, when we talk about community engagement, that it's really most important to understand how significant it is, particularly when any planning is involving communities that have been traditionally marginalized. And towards that end, the inclusion and participation by those communities is generally very challenging because of how alien those particular communities are to the planners involved in that whole initiative or project. And so it begs you to start to really make sure we're clear about why we need to. We need to rather engage community. And one aspect is to really understand that whatever the project, initiative, or program is that we're talking about designing or planning, we need to make sure that the broad community is involved, because whatever that project is, it has to have some sustainability. And if it hasn't been done, planned, implemented with a full inclusion, it's going to at some point reflect that lack of inclusion in what's required to continue to sustain the viability of that initiative. And the other thing that needs to be kept in mind, I believe, is to really understand that towards the end of trying to maintain sustainability with a project or a plan that has been implemented, is to make sure you are aware that the people who make up the community don't necessarily have all the answers or the capacity and/or capabilities to actually sustain or to run their particular aspect of the project. So this means that there has to be some attention paid to in the planning process towards engagement of the community, how and to what extent there may be a need to make sure there's a component that includes training to ensure these community members are able to carry out their particular respective role. And I wanted to also just make sure we look at definitions of what is the community. And as obviously there are two ways to look at it. One is a community is just as the second definition talks about, it's just about sharing attitudes or interests, or a sense of feeling of just a fellowship makes a community, which is not to be confused with the community which is comprised of a group of people who live in the same place and have specific or particular characteristics in common. Which brings us to a real important consideration. How do we know whether there's a difference between what community is and what stakeholders are? Often there's a very blurred line in many approaches to planning and implementing projects because they're often seen as one and the same by some people. Others see them as interchangeable. My belief is that there is no real simple answer to that, but I try to use a very common and simple approach by looking at, when we talk about community engagement, that versus stakeholder engagement, that particularly for stakeholders, stakeholders for me tend to be people who are only involved or consulted when there's something specific about it that's germane to their particular interest or influence. Stakeholders tend to belong to specific entities or specific organizations. Where when we talk about community engagement, when we talk about planning, that typically means that that's involving folks who have the common characteristics that make them live together, have those kind of things in common. And so therefore they're brought into engagement in the project because this is initiated as a project. And that's also community engagement. Also, I look at it as an area where anybody who has an interest or vested interest of any kind in what is being planned or proposed makes up the community for the engagement. So there's once again, a very thin line and a very often blurred line, but there is clearly, in my opinion and based on my experience, a definite distinction. Often stakeholders are seen as having engaged the community because stakeholders were involved. So for example, someone may have a pizza parlor adjacent to the public space that's being considered for this project. So that's a stakeholder as opposed to someone who's a part of the community, because by the completion of that project, that particular business may have now become a laundromat. So whereas the community, even though the individuals that live in that space and that have cultural and social ties to that space, may have moved on, the culture and the social nature of that community still is reflected by what their input was in the process. Another point I wanted to make sure we kind of at least addressed here is trying to determine who actually represents the community. And I find there are several little categories that typically need to be kept, that we need to be mindful of. Sometimes the person or individuals who are determined to represent the community are people who have been based on just popularity or notoriety. Sometimes it can be the most popular or well-known clergy, or it could be somebody who's part of the typo that should be a long-time resident in the community, somebody who's lived there for 50 years. Or it may be a business that has been a staple, you know, the particular corner store. Or it could be somebody who's actually an activist for particular issues in that particular community over a period of time. So popularity or notoriety sometimes is used as the barometer by which we determine and identify who those people are. Then there's another component that is that's a designation for how to determine who represents the community. It depends on how their synergy is with the actual proposed project is. If there's somebody looking to do urban design or develop urban planning around putting together a community garden, then it's about who has the best garden in their backyard, or people who have a history about what kinds of things have taken place over a period of time in that particular area that may be conducive and lead towards how to make that a better project. Then there are other things that we can look at as a criteria that often is used. It's just people who have an existing relationship with the organization or the entity that's doing the planning, or some related company, business, or organization. And they say, oh, well, Glenn worked with us on something we did 2 years ago, and he lives in that area. He'd be good to be somebody to have on your community engagement component of this project. So people can look at where the existing relationships may have lied in the past. And then obviously there are stakeholder organizations who can make recommendations. So Mr. Will from the pizza parlor may say, listen, one of my best customers is Glenn, and I think he would be good for what you guys are getting ready to do across the street. So, and then finally, the political operative, for lack of a better phrasing, I say political operative. So many public space projects have to have tremendous political support for a lot of reasons, whether it's funding, zoning, whatever the case may be. And oftentimes I have had the experience where planners have felt the need to get recommendations from the political person or entity that they need the support for past zoning or for whatever it may be around the implementation of the project. So they'll say, hey, listen, we want to make sure the communities involve councilmen or congressmen or state representatives. So do you have any recommendations? So that person may then have someone that they will designate as their quote unquote representative of the community. So I just wanted to point those out because I think it's important. I've seen how that has really served a lot of projects well. And I've also seen how it has, when not acknowledged, that there are different ways that you can approach defining and determining who represents the community. I've seen how that can go, the other way around. So all of this shows just that there's more complexity to community engagement than we would like to think, that it can be, as some Benaviste characterized it as the Achilles heel of planning. Since we know that typically and traditionally and historically impoverished or underserved minority populations are often underserved in community development decisions. And this is really important because most of us are in metropolitan areas around this country where there is a lot of transitional work taking place in cities and neighborhoods. There's a lot of gentrification. There's all kinds of things taking place. So it really means that we're transforming communities to a large extent. So it's if we're going to engage the communities, and if projects are really planned to be inclusive down the road as these things come to fruition, then we have to make sure that those engaged populations and those existing communities are really informed. They're taught about how their participation actually can and realistically affect the actual decision-making process instead of being brought in after the fact. I just did a focus group, facilitated a focus group for an initiative that had already been planned and already been put together. So all of that being said, that this is the 3 underlying principles that basically everything we've just discussed boils down to. That as we talk about it being an Achilles heel of the planning process, the simplest way and the easiest way to ensure that it's a viable, productive component of planning when we talk about community engagement, that we must build relationships. You have to then strengthen trust by making sure people are informed, that they're provided with the right kind of capacity building so that they can know the benefit to their community, as well as how they can subsequently bring their strengths to the planning process. And out of that, to really make sure that the project itself is a vehicle that forms partnerships.
Renata is a public healthcare, global health, and social innovation specialist with experience in a variety of settings around the world. For over 20 years, she has worked at the interface of health systems, health equity, community health, community and patient engagement, strategy design, and communications for behavioral, social, and organizational change to improve health outcomes and opportunities for socioeconomic development among different populations. She founded Health Equity Initiative, our hosts, and serves as the founding president currently. She also teaches at Columbia's Mailman School of Public Health.
Thank you, Shimpe, and thank you everyone for participating in this webinar. I hope that everyone can hear me. So I would like to just move along with my presentation, and I want to thank again, as the founding president of Health Equity Initiative, both the Robert Wood Johnson Foundation for their support, as well as our partner, the Gehl Institute. So this presentation is going to be a brief overview of lessons learned from international settings, from my own professional experience outside of Health Equity Initiative, but I also would like to present a case study of Health Equity Initiative work and how this applies to urban design and strategies for effective engagement. Most of both my own experience as well as Health Equity Initiative's experience is related to various areas of health, but I firmly believe that lessons learned from community engagement from these areas also apply to urban design settings. So I want to offer a few thoughts on international experiences and why it's important to consider examples from developing nations. Number one, because the communities that are most affected by health disparities share a common history of social discrimination or poverty or lack of access to services. So some of the barriers tend to be the same across different places in the world. Also, community engagement has been used for decades as a strategy to reduce disparities in developing countries and is by far more used than probably in the United States. The other thing that it's important that a lot of these participatory planning and human-centered design strategies have been applied in a lot of developing countries. And as I go through my presentation, I would like you to reflect on how does this relate to your experience in organization and how does this apply to the community stakeholder you seek to engage on urban design, so that as part of the Q&A, probably you can also share with us some of your own experiences. My experience, as a global health practitioner for many years is fairly international, and I need to say that my passion for community engagement started many years ago in Angola when I was working on a program with UNICEF and the Ministry of Health of Angola and going in refugee camps, speaking about malaria prevention. And I learned then how important it is to listen to the community and also to really listen that if malaria prevention education, for example, is not their priority, you need to start addressing their priority first before bringing them on board on other things that may be important to them, but not their priority because they are concerned with food, clothing, safety, and other things. So the process I've been implementing throughout a lot of my work is very similar to many other models for community engagement, but I feel that for authentic engagement, you need to build capacity for communities to effectively participate. You need to map who influence them, and then they can effectively go through the other steps of the process of design of any kind of intervention, of any kind of evaluation and research they can contribute to. And this process, recognizes the expert in everyone, really recognizes that, yes, all of us have some specific competencies, some specific skills. We may be public health professional, healthcare professional, or urban designers, but ultimately communities are the experts on their needs, on their preferences, or what they want to see appear. So there are a number of examples in existing literature of community engagement, and definitely the recent Ebola crisis demonstrated how important is to make sure that community participate in innovative solution, whether it's about healthcare system design, other services, transportation, and so on. With that premise, I want to share with you a case study from Health Equity Initiative, some work we did in partnership with the Office of Minority Health Resource Center. And if you're interested in knowing more about this, the full article was published in October of last year on the Journal of Health Disparity Research and Practice. I wanted to first introduce a bit of the program that we were working on in partnership with the Office of Minority Health Resource Center, which is a Healthy Baby Begins With You campaign, which has multiple components, but primarily aims to increase awareness of health disparities and especially infant mortality disparity, a key indicator of health equity among many communities in the United States, and more specifically the African American community. And also wanted to encourage a set of behavior for people to stay healthy, preconception health, which is a set of 12 behavior that range from checking yourself at the doctor every year to eating healthy to exercising and so on. So the situation on when we started working with the Office of Minority Health Resource Center, which is a project of the U.S., the HHS Office of Minority Health, there was a very large group of preconception peer educators that the program had trained, and there was the need for further support and community engagement so the program could become sustainable by the partnership with local community-based organizations. At the time, there were more than 1,500 preconception peer educator, primarily college and graduate students who have been trained, and the sustainability of the whole project was really depending on the ability of communities to act on their own. Several experiences also validate this systematic approach to partnership development and management on the agenda setting, the partner satisfaction, and the continuity of all partnership. This is the process we follow, which went from identify local partner to train everyone on developing task force and multisectorial partnership, which is a module that unfortunately in many of our fields is not included in formal training. In the business field, students take a lot of courses on negotiation skills. They take a lot of courses on public-private partnerships in public health, healthcare, community development kind of programs. So this is not a course that is very often offered. So we felt that bringing everyone on board on how to work together, understand the language of different sectors was an important way to start the project. So then we developed tools and resources for actually establishing a task force, and we developed a number of resources that were actually determined by the group themselves. And we also did a participatory planning exercise that actually included an action plan development and in the 4 cities where we operated. So we had the 2 days meetings in Nashville, Charlotte, and Jacksonville and Los Angeles, which were cities in which you know, basically infant mortality rates are very high. We had 87 participants, and really this was a multi-sectoral exercise because we had the Department of Health, academic institution, community-based organization, community members, private sector, the students, everyone together. And we use a participatory planning and human-centered design method to actually making introduction across sectors, providing professional development on partnerships and development, and also encouraging the development of a strategic plan for task forces on infant mortality. This is some of the plans that were developed, and again, there were some recurring objectives like the lack of awareness of infant mortality, and some specific objectives in the 4 cities where we operated, where we worked together on these plans that were really the expression of the group feelings and the group needs and the group preferences. And again, if you want to read about this case study, you can go to the paper. So again, the plan was touching upon all of these different kind of stakeholders and how to engage them, and the original group that we convened had the intention to engage all of them as well. We also did, which is very important, some agreed on measure for partnership success. As everything, partnership is a very difficult process. So we wanted to know what would have made people to stay in a partnership. And so these are some of the categories that the participants mentioned, like a personal commitment to complete tasks on time and attend meetings regularly, organization and effective use of time, the transparency and effective communication, mutual benefit and ability to share the spotlight. Those were all things that they came from the participants, and they were an expression of their needs in order to stay long-term in a partnership. We also looked at barriers, and there were some of them that were not surprising, like program continuity, funding, and other similar things. But there were also other issues that were very honestly discussed, like what the participant called turfism. And so the usual competition may go between organizations on the ground, even when the thing at stakes is equity and mortality. So there were a number of project-specific lesson learned, but I want to focus primarily on the overall lesson learned that are relevant to community engagement. The first, that despite differences in levels of knowledge and experience with students and academics and business owners, participants were able to work together effectively. And this was due to the interactivity, to the human-centered design principle that we implemented in actually leading this effort, actually providing community ownership, providing ownership to all participants, and providing also skills for partnership development and participatory planning. We also thought that the involvement of local Department of Health, an academic center, was also key to engaging the students at the local community-based organization, because there were a number of them who were already working with community-based organization locally, and obviously the involvement of the Office of Minority Health Resource Center in securing and recruiting attendees for the initial effort. One other lesson learned was that, yes, we rely a lot on technology, but interpersonal communication and in-person meetings are very important to bring to life local situation, brainstorm, and really that personal human touch cannot be substituted all the time by emails and visual communication. So we also had to keep flexibility to adapt to local situation and accommodate for integration with existing effort. So bringing this all back to civic engagement in urban design and how these lessons apply to urban design and civic engagement, the first thing is to keep an open mind. And I always will remember the woman in a refugee campus in Angola looked at me and said, "You want me to talk about malaria prevention? I don't know how to feed my children." And that has been a lesson for me throughout my whole career, really the importance of listening to the community and listening what their first needs are. So be prepared to address other group-driven priorities. Just this is very connected to that. Just like in my experience, when you walk in a community, if the priority is different, it's important to start addressing them first and then bring them on board on what you think that may be important to you. So the other thing is that you have to consider potential bias within the group. We all come with some bias and maybe against a specific idea or a specific ideology or a specific group. So it's important to go in this community engagement efforts by researching different perspectives and bringing them in the open, understanding power structure and understanding influencers mapping, and engage people across systems and sectors and all of these different power structures. It's also important to bring results in a short period of time. So also a lot of time we talk about community engagement, but not building capacity for real empowerment. It may result in not very meaningful engagement. This is especially important for low literacy and underserved group. That's what also Glenn was mentioning. It's important to identify leaders and champions and showing them the way to participate instead of telling them to participate, and include a training on how to negotiate with different partners and to actually go about understanding the language of different places. So in this process, normally the facilitator role is solely to provide technical assistance, and it's important to use small group processes to create community and provide a voice to those who may be the weakest within the organization that you bring to the table or the leaders you bring to the table. The other thing that is an important lesson learned is to set the right expectation. You know, so a lot of time people go into communities and with very good intentions and speak about a lot of great things that can happen there. But we all know that no process or intervention is a magic bullet. So setting the right expectation prevents basically community to feeling motivated to participate next time just because their idea of success was different from your idea of success. So discuss those expectations is an important part of the process. And don't stop at intervention design. Engage participants also in intervention implementation, evaluation, because in this way you will create a constituency of committed citizens who work toward a common goal, a common objective to improve the equity and other community. At the end, it starts all with you, and it starts with fostering a culture of engagement in your organization and community. Keep a sharp focus on community benefit and social change. So because the community obviously need to participate, because they also understand that their needs and preferences are being heard, and advocate for increasing funding and new policy to do this kind of work that many people may feel take time, and therefore it's easier to have expert-led kind of processes, but in the long term it creates sustainable programs so that the community can really benefit from. I try to speak very fast, much faster than any New Yorker, and so thank you everyone, and I want to thank again the Robert Wood Johnson Foundation for their support and Gehl Institute for being a wonderful partner. Back to you, Shimpe.
Thank you, Renata. That was wonderful. You shared so many great examples. Next up is Myrna Caban-Lezcano. She is the Associate Director of Education and Cultural Organizing at the Highline, where she brings over 10 years of experience in arts and social justice, education, community organizing, and leadership development. Myrna migrated to the US from Puerto Rico when she was 9 years old and was the first college graduate in her family. She holds a BA with honors in music, literature, and women's studies, and an MS in urban policy and nonprofit management from the New School. Myrna is also an herbalist and the founder of a healing arts collective in Brooklyn.
Thank you so much for having me. So I'm excited to share the work that we do at Friends of the Highline, and specifically the work that I do with my colleagues in the program's Education and Community Engagement Department. So the Highline is a public park maintained, operated, and programmed by Friends of the Highline in partnership with New York City Department of Parks and Recreation. The park is owned by the City of New York. It is a 1.5 mile long park that spans 3 neighborhoods and welcomes 7.9 million visitors each year, with over 2 million of those visitors being New Yorkers. And Friends of the Highline, which is a nonprofit that runs the park, raises 98% of the Highline's annual budget. So our mission is to seek to engage the vibrant and diverse communities on and around the Highline and to raise the funds that are needed to complete the Highline's construction. I do want to add that we are now engaging in a process which we are talking about how we prioritize equity and the experience of New Yorkers in our mission, and are really talking about updating this mission and vision to include this focus. So the park was built on an abandoned elevated railway, and it was slated for demolition in 1999. Conversations about this demolition were happening in a series of community board meetings. And two local residents, Joshua David and Robert Hammond, attended one of these community board meetings. And they decided they wanted to save the High Line. And after many conversations, decided to form Friends of the High Line in 1999 to convert the abandoned space into a park. And some of the key stakeholders that they engaged then were, of course, the city, real estate and developers, and the different communities surrounding the area. And so this is really where my work is grounded and where I can speak to the most. Before the park opened, there were a number of community engagement efforts that the co-founders and FHL staff at the time engaged in. This included forming partnerships with long-standing local nonprofits who were really experts in the neighborhoods and in working with the folks who'd lived for a long time in the neighborhoods. They held community input sessions where they asked folks what they wanted to see on the park. They held a public design competition for how the park would be designed, and formed partnerships with local schools that entailed different art projects on and beyond the park. And at different parts of the way, they made sure to engage residents of a public housing development through different sessions and different pizza parties. So this is a photo of one of our community input sessions at the time. And this is showcasing all the designs that were submitted for the competition. So we took some of these designs and exhibited them in Grand Central Station in 2003. So again, thinking about how we engage folks both on the park and beyond the park in the work that we were doing at the time. So the first section of the park opened in 2009, and this is where this is when a lot of our public programs began, and our deeper community engagement began. So our public programs ranged from walking tours to family programs to a variety of artist talks and displaying public art on the park, workshops, dance performances, theater performances in partnership with local organizations. And as you can see from the photo here, even a teen step showcase. So really thinking about how do we take this park, which is a public space, and convert it into a public space for all. So when talking about health equity, we see our programs as one of the ways to contribute to the resiliency of our local residents and the ways that they come together in this public space. So the park had been open for 2 years in 2011, and we realized we really were not getting the diversity in terms of the visitorship onto the park. So we partnered with Yancey Consulting to launch a community engagement survey in 2011. And we hired 6 local teams who lived in the public housing to help us do this survey, and engaged our staff. And we surveyed over 800 residents of the Fulton and Elliott Chelsea houses, and also engaged a number of community stakeholders, from staff to community board members to members of local nonprofits. And we found out, at least 42% of folks didn't even know the park existed. We found out some good ways that they prefer to be in touch and to hear about our public programs. And really important to the work that I do, folks said that they wanted to see job opportunities, horticulture opportunities, and more public programs. So in 2012, we launched the first of our teen jobs. Back then it was 15 positions for teens ages 14 to 19. And now in 2017, we have 35 positions for teens. These teens either live or go to school in any of the neighborhoods surrounding the park. 50% of them are residents of our local public housing. And these young people primarily work in 3 different areas: urban gardening and food justice, arts and social justice, and neighborhood engagement. So I want to highlight the work of our Green Council, which is a group of 14 teens who learn about plant science, work both on the park and in green spaces throughout the city, and they learn about food justice. And they are now part of a youth food justice network with other youth organizations from throughout the city. So again, in thinking about equity and health, we are a part of a network of young people who are really thinking critically about issues of food access and you know, creating a platform which young people can share their work. This is a photo of one of our teen nights. So our teens design these public events that bring over 1,400 teens from throughout the city. So thinking about how a public space can be a platform where young people can come together from throughout the city, from different walks of life, and be engaged in a place that feels a little bit safer, an event that is designed for and by them. Our young people are also involved in participatory budgeting, which is a process that started in Brazil and has come to the United States. So we do participatory budgeting in partnership with our council member, Corey Johnson. So this is a process by which residents of a neighborhood or an entire district propose neighborhood improvement projects. Those ideas get put on the ballot and the winning ideas get funded and implemented. So in the second year, our young people proposed planting of more trees throughout the entire district, and their idea won with over 2,000 votes in the community. Our young people also participate in our Neighbors Council, which is a group that we started last year of about 20 folks who are local experts representing a broad range of key stakeholders. And they are really folks who we seek and have conversations with around different programs, and we're really thinking about how we co-create, how we're going to co-create programs alongside this group of folks who are really important to us. We have a variety of public programs ranging from concerts to performances. Some of them span the entire park. Last year, we saw over 15,000 folks come onto the park to participate in these public programs. One of our longest standing public programs is a salsa night called Arriba. So this is a photo of that. So again, a space where folks can be in community, can hear music that is relevant to them, that speaks to their histories and the histories of the neighborhood and of New York City. We offer well-being programs, meditation, Tai Chi, and yoga, all free and open to the public on the park. We have family programs that bring over 11,000 attendees. So young people get to see local artists. They get to engage with the local environment, learn about the plants we have on the High Line, and also learn about the history of the neighborhood of the High Line and the neighborhoods of the High Line before the park was opened. We have a robust volunteer program with almost 200 volunteers. I want to highlight 2 of the programs that our volunteers lead, which is a neighborhood buddy program. It's an intergenerational exchange between students at an elementary school and volunteers. And so they get to share some of the untold stories and histories that folks know about the neighborhood. And we also partner with our council member Corey Johnson's office to support their senior food bag program. So volunteers support the bagging of local produce and ensure that this produce is distributed to seniors throughout the district. So some of our engagement strategies that we're really focusing on is building long-standing, authentic, reciprocal relationships with a broad range of stakeholders, from community boards to residents to artists to families. So not just going to folks and asking them for things or asking them to come to our programs, but really having conversations where we're talking about how to support each other's work and how do we want to envision the change that is happening in our neighborhood. So prioritizing neighborhood residents, local partnerships, and when hiring, prioritizing hiring local residents, including young people, as you saw from some of our team jobs. We think that we should be sharing the power and the resources. So providing our space, providing the space of the park for community events and different neighborhood meetings, being regularly present in all neighborhood activities. So again, supporting the work of our neighbors and different neighborhood organizations, providing updates to key stakeholders at every step of the way, and ensuring that our presence is both off-site and on-site. This is a photo of a community board 4 meeting held on the park. Some of our team staff supporting a Fulton Houses Family Day off-site. One of our teams showing a neighborhood resident in the Lower East Side how to plant from seeds. And so some of our key takeaways or lessons learned are how to ensure that community engagement is central to the organizational culture and not just housed in one department. As I mentioned before, creating engagement opportunities rooted in educational programs that go beyond the public space, our public space, listening to the needs of a broad spectrum of local residents, and partnering with a variety of organizations, communicating often and having conversations through a variety of channels, and keeping up to date on what channels work best for folks. So is it texting? Is it doing street outreach? Is it doing flyers literally on the buildings of our public housing, and centering the voices and the stories of people of color and long-term residents, ensuring that our public spaces are interdisciplinary and welcoming to all, from the moment that folks arrive and engage with frontline staff to the ways that language is accessible in all of the communications pieces, and evaluating all the programs through different platforms and approaches, so both in person, handwritten surveys, digitally, and being a platform for community dialogue, civic participation, and change. And I know we're running out of time, so I will skip to the end here. I know we have maybe a little bit of time for questions, not sure where we're at. Thank you so much.
Great, Myrna, that was wonderful. We actually had a couple of questions about how to engage youth, and your example was really great. Just because we are short of time, we're past our time, I want to remind everyone that this is being recorded and will be available on the Health Equity Initiative website later on. And I'm going to summarize one question that came through. It sounded like people are grappling with, pretty gigantic projects in their community. And for each of the presenters, maybe they can say, if there was something that everyone on the phone here or listening could take away from this conversation in community engagement for health equity, where is one place to start? How do you start this process of engaging the community?
No, all I can say is that I think the way you have to start by engaging the community before you plan the project. I think as best as possible, because otherwise you're now telling them instead of engaging them.
Yeah, and I can agree with that because it's very important to get their feedback, the community feedback and input, and having them effectively design any kind of process since the beginning, but also something that emerged from a number of experiences, including our summit last year, is to go where the communities are, because sometimes engagement is difficult for people who have difficult priorities, that they have 2 or 3 jobs, the children at home and so on. So try to go where the community are is also a way to start the process of engagement.
Would agree with what folks have shared, and there are a number of models out there, and participatory budgeting is one of those. And just ensuring that you're examining, who are the networks that you have, who are the people that you're building, and sort of pushing towards your edge in examining that and going beyond that.
Great. Well, we're at the end of the webinar. I want to thank Health Equity Initiative for having me. Thank you to all the presenters for their wonderful, thoughtful presentations. And again, the recording will be on the website. And I'll pass it along to Health Equity Initiative if they want to close this out.
Definitely. Thank you, everyone, for your participation in today's webinar. We hope you enjoyed the content. Like it has been said, we will share the recording as soon as it's available. I have currently posted a survey link in the chat section. Please view it, and we ask that you take 5 minutes of your time to complete the survey. Also, please mark your calendars for February 23rd, 2018. HEI will be hosting their annual summit. Thank you all, and have a great day.